Hello everyone, my name is Matheus Araujo. I am a PhD student at the University of Minnesota, and today I'm going to show you how to visualize telemetry metrics to enhance sleep therapy management. In this project, our focus is the following. We want to provide doctors and sleep clinicians with detailed information to easily classify therapy use and sleep patterns. So we want that the doctors understands how the patients are using their devices and then takes actions from it. But first, let's talk about sleep apnea, which is the problem we are solving in this situation here. The sleep apnea is a big issue in the US. 22 million Americans suffer from sleep apnea today. And it is also linked to the increased chance to have a stroke and also the increased chance to have diabetes. There is the traditional way to solve sleep apnea, which is use the CPAP mask. However, there are a huge problem regarding adherence to this therapy. There are many reasons for this problem, from social reasons to claustrophobia. But today we are going to talk more about the UAS therapy, which is an alternative to CPAP, which has as main component an implanted device that sends signals to the hypoglossal nerve of the patient. And these signals helps the patients to sleep and breathe well while they are sleeping. And to control this therapy, the patients have in their hands the sleep remote control. With the remote control, the patients can start, pause, turn off the therapy, or even increase or decrease the intensity of the stimulation. By understanding the interactions between the patients and the control, we can derive these visualization cells that are plotted nightly. Every night we plot them. On the left we show the day the patient starts to use the device. On the right, we show the day the patient stops to use the device. And in the middle here, we have midnight as reference. So in this vertical green line here, we show when the patient starts the therapy. There is this yellow region which shows the delay time of the therapy. And then we have this green horizontal bar that shows the time the therapy was on. And in the end, we have this vertical red line that shows that the patient turned off the therapy. What is nice from these nightly cells is that we can stack them up in a monthly period. So here we show 30 days of use. And in this case, the patient shows a quite consistent use of the therapy. And he also sleep in very consistent time frames. However, this is not always the case. As in this example here, we showed on the right that the patient started to use the therapy quite well, but after in the second month, he started to pause too much, as showing in these purple regions. And this can be a signal to the doctor that this patient may need to go back to the clinic and check what is going on with the therapy. In this other example, we show a new kind of behavior in which the patient turns on and turns off the therapy quite frequently, and usually this is not what we want. So the doctor could recommend this patient to go back to the clinic for a new round of training and also to start to use the pause button. This is all that we have for you today. Thank you very much for watching this video. In the paper, you can see other examples of behavior, and also we have a new kind of visualization tool that also helps the doctors to help the patient. As contributions, this is the first use of a visualization system for long-term implanted therapy management, which is new, and also we can assist clinicians to determine the programming needs to improve therapy response as they need. I want to thank Inspire, and also I want to thank University of Minnesota for collaborate for this project. Thank you.